Hello guys, welcome to my channels, and today we will discuss about the pharmacokinetics. Let's start the pharmacokinetics. Please don't pause the video and see till last and give your opinion in comment box. Also please subscribe and like my channels. Let's start the pharmacokinetics. Pharmaco means drug, kinetics means movements. The movements of drug is called pharmacokinetics. It involves ADME drug absorption, distribution, metabolism and elimination. In short, we call that ADME. Let's overview of the pharmacokinetics. Pharmacokinetics, drug administered and it undergo absorption and then distribution, then elimination, metabolism and then elimination. Transfer to site is metabolism and distribution are again transferred. There is reversible. Okay, and regulatory protein then bind to molecular targets, that is called affinity. Affinity means bind. These are under the pharmacodynamics, mechanism of drug action and response to drug, that we call as efficacy of the drug. Okay, let's start introduction to absorption. Now we will discuss one by one. ADME, that is absorption, distribution, metabolism and excretion of the drug. Let's start the introduction to absorption. Definition: absorption is the process of movement of unchanged drug from the site of administration to the systemic absorption. It is first the process of movement of unchanged drug site of administration to systemic circulation. There is always exists a correlation between the plasma concentration of drug and therapeutic response. Thus, absorption can also be defined as the process of movement of unchanged drug from site of administration to the site of measurement, that is plasma. So we call that the process of movement of unchanged drug from the site of administration to the site of measurement, that is plasma. Now let's drug absorption is the passage of drug through cell membrane to reach the site of action. This is what's the passage of drug from through cell membrane to site of action. Mechanism of drug absorption includes simple diffusion, also called passive diffusion, and second is filtration, and then facilitated diffusion and active transport and pinocytosis, also endocytosis, also called endocytosis. Simple diffusion: most of the drugs are absorbed by simple diffusion or passive diffusion. Most of the drugs are absorbed by simple diffusion or passive diffusion. No energy is required. In active, there is energy is required. Okay, in filtration there should be membrane. In facilitated there will be the facility for diffusion. Okay, and active transport there will be the required energy for transportation. Let's start the cell membrane. Cell membrane, also called plasma membrane or plasma lamella, phospholipids bilayers. It is made up of phospholipids bilayer. Cell membrane mainly consists of lipid bilayer. Lipid bilayer consists of phospholipid, cholesterol, glycolipids, protein, transmembrane protein, lipid anchored proteins like G protein, peripheral proteins. Now the plasma structures of plasma membrane structural components consist of glycoprotein, integral proteins. This red color indicates the integral proteins, and carbohydrates, hydrophilic region, hydrophobic region. Hydrophobic means inhibited, water inhibited. Philic, hydrophobic region, hydrophilic region. transmembrane fluid. This is the structures of which fluid mosaic membrane models. Okay, let's discuss the simple or passive diffusion. Simple diffusion, drugs are mainly two types. One is water soluble drug, another is lipid soluble drugs. Water soluble drugs are ionized or polar. Lipid soluble drugs are non-ionized or non-polar. Water soluble drugs are radially absorbed by aqueous channels or pore in cell membrane. But lipid soluble drugs are non-ionized, non-polar, radially absorbed via cell membrane itself. The difference is that lipid soluble drugs are absorbed via cell membrane through itself. Simple diffusion. Simple diffusion, the characters must be followed is the simple diffusion is the common process, occurs along the concentration gradient, means from higher concentration to lower concentration. This is non-selective, not saturable, not selective, required no energy and no carrier is needed. Okay, next figure of simple diffusion. High concentration to low concentration flow of fluid is from high concentration to low concentration. Pore transportation or filtration. In filtration there must be the involvement of membrane, transcellular pore or a small pore, passage of ion through aqueous pore, there must be the pore. Low molecular weight, molecule less than 100 daltons, example urea waters are absorbs. Lipid soluble insoluble drugs crosses biological membrane by filtration. Lipid insoluble drugs are crosses the biological membrane by filtration if their molecular size is smaller than diameter of the pore. Now carrier mediated facilitated diffusion occurs along the concentration gradient, that is from higher concentration to low concentration. Their carrier is required, it is selective, saturable, no energy is required. Now next is active transport, relatively unusual, occurs agents concentration gradient, that is from lower concentration to higher concentration, required carrier and energy, it is a specific saturable process, iron absorption, uptake of levopoda by brain. Another is symport and antiport. Symport means in the same direction, second figure indicates same direction in ATP, movements of ATP. There is towards same direction, opposite direction means antiport. Okay, and then pinocytosis. Pinocytosis is the process of transport across cell membrane, particulate form by the formulation of vesicles. Process of transport across cell in particulate form by the formulation of vesicles that we called as pinocytosis, applicable to protein and other big molecules, contribute little to transport most of the drug. Pinocytosis, vesicles, pinocytosis, process of transport across cell membrane particulate by the formulation of, there must be formulation of vesicles that we call as pinocytosis. Cell drinking process we called as pinocytosis. The cell drinking process we called as pinocytosis. Cell eating process called phagocytosis. Factor affecting the absorption of drug. Factor affecting the absorption of drug are Number one, physiological properties. First is degree of ionization. Highly ionized drugs are poorly absorbed because highly ionized drugs are poorly absorbed. That means drugs are highly ionized that are poorly absorbed in the body. Degree of solubility, high lipid soluble water proportion coefficient increases the absorption. Basic drug, basic medium, basic drug, highly ionized, poorly absorbed. Chemical nature, inorganic iron is better absorbed than organic iron. Valency, ferrous salt is more absorbed than ferric salt. Pharmaceutical form of drug, absorption of solution is better than the suspension or tablets. Absorption of solution is better than the suspension. Solution is the mixture of micromolecules, a smaller micro. Suspension is the mixture of macromolecules. Okay, so absorption of solution is better than suspension. Note the correlation with ionization. Acidic drug, for example, aspirin is acetyl salicylic acid, are less ionized as gastric pH. In stomach, their medium is acidic. Acidic drug, acidic medium, less ionized. The concept is that acidic drug, acidic medium, less ionized, more absorbed. Okay, and basic drug examples: atropine, and largely ionized at gastric pH and less absorbed. Factor related to the patient's route of administration. Absorption of drug is faster from IV. IV is greater than inhaled, is greater than intramuscular, is greater than oral, is greater than dermal administration of drug. And then area and vascularity of absorbing surface. Absorption of drug across intestines, there is presence of microvilli, and because of that there is much more vascularity, and so the absorption of drug across intestine is more efficient than across the stomach. And next one is the state of absorbing surface. Example: atrophic gastritis and malabsorption syndrome decreases the rate of absorption of drug. And then the another term is bioavailability. Bioavailability is what? The fraction of drug that reaches to the systemic circulation in unchanged form. In IV administration there is 100% bioavailability. Fraction of drug that reaches to systemic circulation in unchanged form, that we call as bioavailability. Bioavailability for IV administration is 100%. And the term bioequivalence means bioequivalence occurs when two formulations of same compound have same bioavailability and same rate of absorption. There must be same bioavailability and same rate of absorption. Bioequivalence occurs when two formulations of same compound have same bioavailability, same rate of absorption. The order of bioequivalence is PAROT. The trick is that PAROT, parental is greater than, rectal is greater than, oral is greater than topicals. Route bioavailability characteristics. Intravenous 100% by definition, most rapid onset. Intramuscular, that you will see, easily understood. Okay, and thank you so much. Have a nice day. Welcome to my channels. Please subscribe to my channels and subscribe for another video.